What I want to do is spend a few minutes talking amongst ourselves and building on some of the great themes that came out of your presentations. But as Marianne mentioned, one of the goals of this this conference, and the reason why we kept it intentionally a little bit smaller, was we really want to actually have a conversation that's a little broader. And so I want to leave some time to take both some questions from folks here in the room and also some questions from folks joining us online. But for starters, I actually wanted to build on Maya's terrific points towards the end of her presentation about some of the ingredients for success, and wondering if I could sort of call on Ben and Sarah and Evelyn just to sort of build on that, sort of ingredients for success, things that you've seen that have worked well in successful research and policymaker partnerships. Ben, do you want to start?
Sure. Am I live here, or do I need to press the button?
I think.
Am I good? Okay, good. Good.
Yeah.
Good. So yeah, I think that's a really great place to begin here. We've seen, as you saw on the map, as far as Results First goes, that we work in a lot of different policy areas in a lot of different places throughout the country, and I think recognizing that is a really important place for us to start, and really tailoring our technical assistance and our tools to meet the needs of the different communities that we're trying to serve. And so I think that the building internal capacity and expertise around how to use and build data and evidence into the decision-making process has been really important. Looking for partnerships and folks that know about this work and who care about it, and building champions for it, which I think which Maya touched on, I think is really important. And what we've seen is that the decision-making happens at many levels of government, and I don't have to tell any of you that, but we try to provide support to agencies, folks who are making the day-to-day budgeting decisions, as well as legislatures and governors, knowing that they have an important role to play in the resource allocation. So that's an important part of our project, and also looking for ways to create sustainability. So I want to point to one quick example here of a state where we've been working for a little while and has taken a lot of those ingredients and put them into practices in New Mexico. They've been able to build out the Results First model into all the different policy areas that I talked through, and are using benefit cost analysis and the information provided through the program inventory to invest millions of dollars in different interventions, both in child welfare and early education, but also in criminal justice and in other policy areas. And so they've been able to do that by using the analysis to create kind of a cost of doing nothing report, getting an understanding of, in the crime space, how expensive is recidivism. If we do nothing, how much money is already out the door? And then using cost-benefit analysis as a way to target those very scarce resources to try to make the biggest impact on that larger problem. They've also tried to create administrative policy in the corrections department to try to set a benchmark for how many of their funds are going to be going towards evidence-based programs, and we've seen that be really effective. And so I will turn things over to other folks, but we have a lot of great examples in counties and states of taking these little examples and little ideas and putting them into practice for themselves.
Great, thanks. Sarah, Evelyn, ingredients for success, things that you've seen as sort of best practices in terms of how these things work that you think other people should think about adopting.
Well, I'll start with one maybe element for failure, which is that you're all still calling me Dr. Heller, which I have really fought against. Everyone in the room should call me Sarah.
The cachet.
It's not going to come from me. But I think there's lots of them. One is find the right partners. I mean, we are such cheerleaders for each other up here, so I'm sorry if it's like a little bit sappy, but it makes such a difference to be with someone who understands it and gets it, so that when they tell an academic partner, we just can't do that, you believe them, and you go with it, and you're flexible, and you trust it. Whereas if you're finding the wrong partners and people are sort of motivated by the wrong things, or they're not flexible enough, projects are just going to fall apart, and that can be very frustrating after you've put in lots and lots of time. So I guess one is find the right partners, and two is be flexible. I mean, Maya said this too, but when you're doing these things on the ground, so there's this sort of academic vision, right, of like they're going to come in and explain to you all of the amazing things you do, and then as you hit roadblock after roadblock, you're going to be realizing that things start to seem less and less amazing. But if you adapt, if you talk to each other, if you are in the room, so I guess maybe this is a sub-bullet of be flexible, be in the room, so that when the people are talking about the decisions and they're making some policy decision that they don't know is relevant to what's going to go on, you can hear it and sort of give feedback and engage in this constant conversation, so that the sort of communication part is really important too.
Evelyn, anything? So let me ask a different question, which is at JPAL North America, one of the places we focused as an opportunity to sort of improve the climate for evidence-based policymaking is on administrative data. And part of the reason for that is that when you can get access to good data sets, you can make a randomized evaluation much more effective, much lower cost. You can look at results over time in ways that don't require you to be in as close touch with the population. I was just wondering if you could spend a moment talking about what's worked and what are the sort of challenges that you've seen in these partnerships between a state or local government and a scholar in terms of accessing administrative data, linking data sets, making that an effective part of your collaboration.
I'll start by saying that linking administrative data gives me nightmares. It's so challenging, it's so time-consuming, in part because the technology on the government side is so antiquated. No system talks with the other system. And I think that that's a major challenge. And then once you get through that, if you're able to, there's the next challenge of sharing that administrator with an external partner. So I think you guys do great work in this space. The Actionable Intelligence for Social Policy group out of the University of Pennsylvania also has some great case studies in states and cities that they work with to do effective data integration. But I think it's a major stumbling block. Absolutely.
My entire third year of graduate school was spent arguing with lawyers in order to get all of the data agreements that you saw here together. And you're going to hear Anjali, who is working in the Philadelphia government with the Philly Summer Jobs Project, and I talk about this a little bit tomorrow. It's always a fight, but it's not impossible. And I think more and more as governments are sort of learning the benefits of having some of the sharing go on, some of the barriers are starting to fall. You stick with it, and I guess we're going to talk a little bit more about this tomorrow, so I don't know if I want to sort of give you everything now, I'll tease you a little bit. But it is possible, and academics can help, because a lot of times when agencies are not willing to share data with each other, they're willing to share it with a researcher. And we have the technical know-how to link these systems that don't talk to each other together in a way that is much cheaper for governments, because they don't have to spend their time doing it. So come talk to us, too.
I want to ask one other question, and then I'm going to throw it open for broader questions. And my other question has to do with sort of twin goals of these kinds of collaborations. So one goal is to identify sort of policy-relevant questions that policymakers want to address, and where scholars are in a position to help come up with evidence and inform the decision-making. And then the other goal is to create a movement for evidence-based policymaking, to create a culture within some of these jurisdictions where generating evidence and using evidence is just sort of the way of doing business, right? And I wonder if you could spend a moment talking about that second goal, which is to say, ideally, we get to a point over time where it actually isn't news, right? When there's a collaboration between scholars and city or state governments, and where this is the expectation of legislators or philanthropists, and where when you come in as a sort of mid-level employee of a new government agency, this is the playbook, this is what's expected of you, this is what's taught to you on the job. And my sense is that we're not there yet. And I wonder if you all have any experiences in terms of sort of moving the city of Chicago, the city of Philadelphia, some of our other partners in the direction of sort of being that kind of a best practice, that kind of a culture of evidence-based policy.
So I would say that, first of all, there is can you all hear me? Okay. There is an incredible amount of fear of evaluation, and people are, and I mean people, I mean community-based practitioners, I mean people within government, fear and a little distrust and a lot of misperceptions about what the research is being used for and what the data is being collected for and how it's going to be used. That's true, and it has to be addressed. And so I think one of the things that can't be overlooked is the importance of continuously educating policymakers and practitioners about what's actually so about research and about RCTs and about how data is collected and how it's used. People fear that individual level data is going to be used. There are just lots of wrong ideas about data collection and how it's being used. And so I think that's one of the first things that needs to be addressed. Apart from that, the ways that we've seen the take-up, it hasn't really been that in Chicago, different commissioners of departments have suddenly embraced RCTs. What we've seen is that, starting with the one that we talked about today, that once money started flowing. And I know this seems very simplistic, but money started flowing, and then we did another study, and money started flowing there, and people started to see that the investors, the funders, the people who can make something happen care about these results. And so they started to become more open to being, to subjecting some of their programs to evaluation. And so it's been a little bit of a trickle effect, but there hasn't, I feel there hasn't been yet, it hasn't really made its way through government, right? It's just, it's like, it pops up here and there, people are excited about it in social services on the ground, but I don't see it really permeating through government yet in different departments or in taking this big view about how do we do big cost-benefit analysis. I don't see that yet.
Yeah, and I would say that's exactly why the folks that I work with are so focused on this kind of culture of evidence-based policymaking, and we know that it's a very steep climb, and it's different in every single state. The barriers are incredibly different. The systems of government are very challenging and very unique. And so from our perspective, the goal to center around this culture of evidence-based policymaking is really about starting a conversation about evidence, getting folks who are not kind of used to having these conversations, educated about kind of what tools are out there and how they can harness the power of them to make change in a way that serves their own communities in the criminal justice space. How do we reduce recidivism? How do we avoid spending resources in one area when we could spend it in another? And how do we reduce the victimization that's out there and the social costs of crime? And so in order to kind of have that take hold at a state level, we've really had to focus on building slow and steady. And so we've been around for about 5 or 6 years now, and some of the states we've been working with we started 5 or 6 years ago, and we're still there trying to make it really stick and be sustainable. And like you said, just be the normal kind of operating procedure for how these governments are doing business. So we've tried to help provide research materials and case studies and help define terms and help set the kind of framework for the conversation so that it can really last beyond when all of us here are working in government and around government. So,
Yeah, and I would say that from my perspective, evaluation sits within a pool of many other strategies that are being used to really enhance government's use and ability to use data and evidence. So we think about it in this 3 Ps framework of people, policies, and practices. The people being leadership, if the mayor or the governor or the managing director, whoever the person of authority is, cares deeply about this and talks about it in their speeches, like, that's a big deal, and people pay attention, not just them, the commissioners, the deputy commissioners. If they care about this work, that's an important way to get the entire culture of government to pay attention. On the policy side, I talked about an evaluation policy by way of an example, but you see many different types of policies that help institutionalize that this work exists beyond any one person or administration. And then on the programmatic side, we have evaluations. There's program-based budgeting, which I mentioned from Baltimore, performance management, data analytics, open data. There's so many different tools that groups are using. And so I think to the extent that you can do multiple things simultaneously and sustain them over time, that's how you can also help build this culture of an evidence-based government.
That's terrific, thank you. So I want to, sorry, I'm going to stand up for a second. So I want to open up the conversation a little bit. And I'd like to start taking some questions from the group in the room here. So folks will just raise their hand. Questions? Do we have any questions from the web we want to take? Here, let me start there, sorry.
First of all, I want to thank you for that. That was a great presentation. I think it was great, Russ, with the Cambridge Housing Authority. And the one question I had was, in looking at this sort of as a whole process, at what point in the process would you be able to think about social impact bonds and carrying the potential for that as a possible outcome once you've established sort of where the benefits actually come and lie?
Terrific question. So how do we think about the interrelationship between impact evaluation and alternative financing mechanisms? Folks have.
And this is a topic that we thought about a lot when I was in Philadelphia city government. We did a feasibility study for pay for success programs or social impact bonds and across 2 different outcome areas. And what I learned through that process is that a rigorous evaluation is part and parcel of any one of those projects, or at least any one of a successful project, is to have an external evaluation that's validating the mutually agreed upon outcomes. And so I think that, social impact bonds or pay for success projects is one innovative financing mechanism to do this work, and I think it can seed the broader notion of evidence-based policy in government. I do think it could be a hard place to start, though, just because it is quite technical.
Other thoughts? And we'll have an opportunity to talk a little bit about the Nurse Family Partnership a little later on, which has some interaction between pay for success structure and the RCT structure. Other questions?
So when you scaled up the from 700 people to, say, 4,000 people, you said this upcoming year, did you put in place mechanisms to guarantee fidelity to the model? Because presumably you could have a particular effect with just 700 kids, you start getting to 4,000, 5,000, 10,000, you might lose those effects unless you've figured out making sure you've got fidelity to your model.
Yeah, I mean, one of the challenges that we face, I can't hear myself, so you all can hear me? One of the challenges that we faced was that we funded other organizations to do that first study, and we didn't do a process evaluations. We just ran the study. We don't know how the different providers delivered the program differently. So in subsequent years, we invested a lot in training in designing a very specific curriculum and putting all mentors through a common training, and that before the summer began and then throughout the summer. So that was our attempt to do that. It wasn't until 2015, if I'm not mistaken, that we then inserted a process evaluation so that we could really start looking at how different providers were delivering the program the same or differently. So it took us a while before we started peering into those differences. But I left the city So I don't even know, Sarah can't tell me how that's shaping up until the study is ready to come out. But that's how we did it. It was pretty simple. The jobs themselves were static. It was that the delivery of the program, what the kids get on day 1, day 2, and how their mentors are trained and what their mentors are trained to deliver to them is how we try to standardize a little bit.
And I think it's a crucially important question. So you do one little demonstration project, it works really well. We've seen over and over when you try to scale that up, when you try to put it in a different context, it doesn't work as well. So I think part of the approach we've taken with the summer jobs is that we're trying to isolate what the key mechanisms are so that we know what it is we have to replicate elsewhere. And on top of that, as we've scaled it up, we're continuing to evaluate it, right? So we're sort of doing this iterative random assignment projects where we're learning when you have to find jobs for 4,000 kids instead of 700, do we still see the impacts? And then we're measuring and doing some qualitative work to figure out what types of jobs are happening when you have to scale it up. Do the types of jobs change? So some of it is about just thinking carefully about that and tracking it, and then also measuring that impact so that we can learn as it goes along.
Hi. So just thinking about that first year of implementation when sites might have been doing things differently, do you worry that the CBT element might not have been implemented exactly according to design and that might have been one of the reasons you didn't see an impact on that treatment arm?
I worry that all of it might not be implemented as designed. Implementation is super messy all the time. So yes, and so when I talk about this, and I think I did a bad job of explaining this in the paper, so let me try to take advantage to do it now. I think the message should never be coming out of one study, like this thing doesn't work, right? Because there are all of the implementation questions on top of all of was this thing being taught in other ways in different places? And so I think, again, this is another benefit of doing these kind of iterative studies is that you can try to figure that out over time and document what's going on and try the different pieces to be able to answer that question.
Thank you so much. So this was a terrific conversation. I really want to thank all 4 of you, Maya, Ben, Sarah, and Evelyn for this presentation. We're now going to take a little break, and we'll be back here in 15 minutes, and then we'll move on to the second panel. Thanks so much.